Well, I certainly learned a lot more than I ever knew prior to going through the Dr. Forte program. I mean, I think on the surface level, you obviously know about the reputation of the university. You certainly know about the reputation of the hospital, but to be there and have more of a hands-on experience, to actually see how the work is getting done, how the technology is being used, and what the client care experience looks like was really eye-opening for me. In the space that I work in, which is philanthropic services, we go out and touch lots of hospitals and nonprofit organizations and folks who are having a great impact in the community. But to actually go through this experience and be with really high caliber professionals, to see them, working at their craft and at their best, and to see that with my own eyes was just an experience I'd never ever had in my life. So I'd like to go back and actually go through the tours that I missed. So I was supposed to be, I guess there were two other choices, neurology and cardiology, and I didn't get to experience those particular tracks, but I would love to go through the program one more time to actually experience those particular divisions and to see how care gets delivered over there. But in terms of what I did get to experience, which was ER, the emergency department, and just the hustle and bustle of that experience, as well as the magnitude of something like transplant, and really saving lives and folks who just may not make it unless they're fortunate to get that organ donated and whatnot. That was a fabulous experience for me, and I just wouldn't trade it for the world. There's just nothing like seeing this type of work with your own eyes. It's one thing to read and to hear about the great work that's going on at Emory. Obviously they get a lot of press and whatnot, and they're doing a lot of positive things, but to go there and see it with my own eyes, to spend the time to talk to the nurses, to pull a doctor to the side and have a 10-15 minute conversation about the complexity of the procedure, or how that really is cutting edge, or they're able to do it in a less invasive way and whatnot. All of those things just made it way more tangible for me and gave me a much deeper understanding of the caliber of the expertise and the care that's being delivered at Emory Healthcare. Emory has a stellar reputation across this country and also internationally. And for me, I think that there's great resources that exist over on the university side, and I think mistakenly a lot of folks would extrapolate to think that the healthcare side benefits from all that. And the truth of the matter is that's not the case. And the medical part of the facility needs a lot of support as well. And so for me to actually go see, oh, this is what the ER looks like at Emory. Here's the number of folks that they can serve, over a certain time span. Here's actually where the ambulances pull up and how that area is a little bit more congested, and maybe if that area was reworked, they could deliver better care to folks in this area. It just gave me a much better understanding of there's not this gigantic mass of resources that's there, and they have needs as well. And if we can garner more support for the organization, really we're going to deliver a better experience for folks in this area. After I had my experience, which was incredibly rewarding, I feel like I've told at least 30, 40, 50 people about my experience. I mean, it really was something that was kind of life-changing for me, and something I truly feel blessed to have been a part of. And so when I thought about who I would like to see have that same experience, I really thought about just the most impactful people that I touch and get to have relationships with as I work day to day. And I just want those folks to see this and have that same experience, to just really understand what's being delivered, how it's being delivered, and how we need to do more in terms of rallying around Emory Healthcare and give them the more ability to do the high quality type of work that they do. In my eyes, I think it comes back to just telling the story. And I think part of that story is, just like me, I mistakenly lumped in Emory Healthcare with the resources of the university and thought that there's this big endowment, lots of smart people over there, and they've got a fairly sizable campus, and you just mistakenly think there's incredible resources over there, they don't need my help. And I think for me, when I think about Emory connecting with philanthropy and getting more support and more donors, I think part of it is what we're doing today, which is getting out there, telling the story, being very crisp and clear about the direction and how Emory Healthcare is a leader in this space. Nationally in terms of our rankings and whatnot, we've got some of the best marks we've ever had. But that still doesn't mean that we don't need support and that we don't have to do more. And I think there's a lot of folks who just don't understand that story and don't understand the reality of here's kind of how we're resourced and how we're staffed over there today, and that more could be done.